Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about chikungunya. Now, many listeners may not have heard of this disease because it's really not that common in the United States, and very few people are recommended to get the vaccine. This virus was first identified in 1952 in Tanzania, so its name comes from one of the languages that are spoken in that country. Chikungunya relates to a word that means that which bends up, and that's because of the joint pain that's caused by this infection. When people have severe joint pain, it can result in them having changes to their posture and their ability to move certain joints, and it can last for months or even years. During the next little bit, we're going to talk about the disease caused by chikungunya, the vaccine that protects against it, some of the questions we get here at the Vaccine Education Center, and the relative risks and benefits of this disease and vaccine. So let's get to it. Chikungunya is most common in tropical and subtropical regions of Africa, Asia, Europe, and islands in both the Indian and Pacific Oceans. It's spread through the bite of a mosquito when the mosquito has the virus. And it's a somewhat circular situation because infected mosquitoes bite people and infect people. And then if people are infected and a mosquito bites them, then the mosquito can become infected. Now, the virus can also spread in a few other ways, including to healthcare workers and laboratory personnel if they handle blood that has the virus in it. And on very rare occasions, the virus can spread from a pregnant person to their developing baby, particularly if that person's infection occurs during the second trimester. The baby can also be infected if the person's infected during delivery, but the virus has not been found in breast milk. Now, symptoms usually begin within 3 to 7 days after a person's been infected, and they last for about 7 to 10 days for most people. Importantly, not all infected people will have symptoms. But if symptoms occur, they can include things like a high fever, severe debilitating joint pain. It can be in multiple joints, but most commonly it occurs in the joints of the hands and the feet. People can also have headache, fatigue, muscle pain. They can experience nausea or vomiting, and they can develop a rash. The joint pain and the tiredness or fatigue can be particularly severe and can last for months or even years, but people usually don't die when they have chikungunya virus. If someone has complications, they can experience things like inflammation of the eye, damage to the liver or their kidneys. They can have a swelling of the brain or spinal cord and other neurologic damage. Some people can develop Guillain-Barré syndrome. People that are most commonly affected with these more severe symptoms include newborns, people over 65 years of age, and people with underlying health conditions that would make them more susceptible. So let's turn our attention to the chikungunya vaccine. Most people in the United States are not recommended to get this vaccine because of their low risk for exposure to the virus. And while this is considered a travel vaccine, most people can actually protect themselves even during travel if they take sufficient steps to avoid mosquito bites. This includes doing things like using insect repellent that contains DEET, wearing protective clothing, choosing lodging that has air conditioning or screens over the doors and windows, or if you're in a place that doesn't have screens or you're sleeping outside, then using a mosquito net. People who are recommended to get the vaccine include those who work with the virus in labs, those who are traveling to areas with current outbreaks, and those who are traveling for more than 6 months to areas where there's an elevated risk for an outbreak. If you're not sure whether this would include you and you're getting ready to travel, do talk to a healthcare provider, or if you work in a setting where you think you might potentially be exposed to the virus, talk with your occupational health team. And also, if you're traveling, a travel medicine clinic can be a great resource. Those experts can not only help you with figuring out whether you need chikungunya vaccine, but they can also talk with you about other aspects of your trip as well, so that you can make sure you're prepared both before and during, as well as after your trip. We have information about how to find a travel clinic on our website at vaccine.chop.edu, and you can look specifically in the vaccine schedule tab of the website and find the section called Considerations for Specific Groups, and you'll see travelers listed there. Currently, there's only one vaccine available in the United States to protect against chikungunya, and it's approved as a single dose for people who are 12 years of age and older. This vaccine is made in a way that's similar to the HPV vaccine, in that the vaccine contains proteins from the chikungunya virus that fold themselves to look like the virus, but the vaccine doesn't actually contain genetic material. So even though it looks like the virus on the outside, it's really only the coating or the shell of the virus, and that means it can't cause an infection. Now, because these proteins fold to look like the virus, they are often referred to as virus-like particles or VLPs. And sometimes this vaccine is called a VLP vaccine when people are talking about it. So that's what that means. Now, the proteins that are contained in the vaccine are made by putting genes for those proteins into small circular pieces of DNA that's inside the cells. So there are 3 points here for context. First, remember that genes are like blueprints. They tell the cell how to make certain proteins. So in this case, the cell would be making the chikungunya virus proteins. Second, small circular pieces of DNA are called plasmids. So you may hear people refer to that. And third, the cells that these plasmids are in are actually human embryonic kidney cells, known as HEC293 cells. These cells were isolated from a terminated pregnancy in the early 1970s, and then the cells were modified in the lab so that they include adenovirus genes that make them particularly good at producing proteins from genes that are available in plasmids within the cell. Now, while this vaccine has an association with fetal cells, it's important to realize that unlike other vaccines that are made in fetal cells, in this case, the virus is not growing in fetal cells, but rather the fetal cells are producing a protein that's used for the vaccine, or all of the proteins that are used in the vaccine. We talk about this on our fetal cells page in the vaccine ingredients section of our website at vaccine.chop.edu. Sometimes people wonder how well this vaccine works. And it's important to know that the clinical trials for the chikungunya vaccine were based on the development of immunity. And that's because the disease doesn't occur in large numbers of people, so that it was easier to measure immune responses to understand how well the vaccine was working. And what they found was that in about 98 of every 100 people between 12 and 64 years of age, they developed an immune response within 3 weeks of getting the vaccine. And among older people, that is those 65 and older, about 87 of every 100 developed immunity. Now, they brought those people back for blood work about 6 months after they got the vaccine, and they found at that point about 85 of every 100 12 to 64-year-olds and about 76 of every 100 people 65 and older still had measurable immune responses. Obviously, this vaccine is still being evaluated to see how long immunity will last in the majority of people who receive it. Now, side effects included pain at the injection site, tiredness, headache, and muscle aches. Because this vaccine is a newer vaccine and it's not recommended for large numbers of people, we don't really get a lot of questions about it here at the Vaccine Education Center. But 2 questions are worth reviewing. The first one is that some people wonder what to do to protect children who are less than 12 years of age that are traveling, because remember, this vaccine is only approved for those 12 years and older. So to protect children that are younger than the age at which they can get the vaccine, you would want to do the things that you would do to protect people from getting mosquito bites, things we mentioned earlier, using insect repellent that contains DEET, wearing loose-fitting clothing that covers both the arms and the legs and using closed-toed shoes, and staying in lodging that has either screens on the windows and doors or air conditioning, and if sleeping outside, using mosquito nets, or if you're in a place where screens are not available. Also, as a reminder, children that are less than 2 months of age should not be exposed to insect repellent that contains DEET, and those older than 2 months of age should really be exposed to only limited quantities, the lowest quantities of DEET that you can accommodate and still protect the children. The recommendation is also that children don't use combination sunscreen insect repellent products, and that's because if you need to replenish the sunscreen, you don't want to keep replenishing the insect repellent as well. Now, if you are traveling and somebody in your party develops symptoms like a fever or a headache or joint or muscle pain or a rash, and you think they might have been exposed to chikungunya, you definitely want to see a healthcare provider and let them know about your travel so that they can help sort out whether there was an exposure or some other infection. Now, the second question relates to a second chikungunya vaccine that was available. An earlier version of chikungunya vaccine was available in the United States between November of 2023 and August of 2025. That version was a live weakened viral vaccine, so it contained weakened chikungunya virus. Earlier in 2025, a small number of cases of elderly people experiencing either cardiac or neurologic events were reported. They were brought to attention and reviewed. These cases were severe enough that they required these individuals to be hospitalized. So in April of 2025, the vaccine had a precaution added for use in people 65 and older. Now, precaution means that people should work with their healthcare provider to evaluate the relative risks and benefits of getting the vaccine, knowing that in this case, people over 65, particularly those with underlying health conditions, could have these more severe side effects. That same effect had not been found in younger recipients at that point in time. But by August 2025, two things happened. Reports to the FDA that reported that there was a high degree of certainty that at least one person had died as a result of their complications from the vaccine. That was an elderly person. And the second thing that happened was that a person who was 55 years old who had underlying health conditions experienced complications. And that suggested that maybe this safety concern was more widespread and potentially more severe than what was evaluated with the cases that had been reported by April. So the FDA stopped use of that vaccine in August of 2025. We have more information about that vaccine and the vaccine studies, as well as these rare side effects of the live viral vaccine on our website at vaccine.chop.edu. So let's finish up with a look at the relative risks and benefits of this vaccine. Today we talked about the fact that chikungunya is not common in the United States, so the number of people who can benefit from getting this vaccine is relatively limited. As such, it's only recommended for certain travelers, either based on where they're going or their itinerary. And it's also recommended for people who are at higher risk of being exposed based on their occupation, such as people who work in a lab. Now, when people are infected, we talked about the fact that not all of them are going to experience symptoms, and most people are not going to die even if they are infected with this disease. However, for those people who do have symptoms, they can have severe joint pain that can last for months or even years and may include severe fatigue. They can also experience rare complications, and that's in a small number of people, but they can be things like Guillain-Barré syndrome or GBS, or neurologic complications. The VLP vaccine that's available in the United States at this time can only be given to people that are 12 years of age and older, and the side effects tend to be mild, if at all, and include injection site pain, tiredness, and muscle pain. For these reasons, when our team evaluated the relative risks and benefits of this vaccine, we felt that most people would not benefit from getting the vaccine because they are at increased risk for this infection. But for those who are at higher risk, The vaccine has been shown to be safe. That is the VLP vaccine that's currently available in the United States. But we do need to get more data related to how long immunity lasts and how efficiently it protects against infection. So we hope this helps, especially if you're in one of those groups who may be considering getting this vaccine. And we appreciate your taking time to listen today.